episode of Fun Facts at the Pharmacy. I am your host, Dr. Christopher Greider. In case you don't know anything about me or if this is the first time you're watching it, I'm actually a pharmacist who works for the Mark's Pharmacy chain here located in Northeast Ohio. The purpose of the show is just to give you guys some general information about current health issues or trends that are going on and things that we can do to help them out. So starting off today for our fast-acting portion, we're going to talk a little bit about drug recalls. Within the last few weeks, I've had a lot of people requesting and asking questions about drug recalls at the pharmacy. One of the biggest things is hand sanitizer. So if you watch any of the local news, there's been a lot of issues with different hand sanitizers and different companies that they've recalled for various reasons. It could be from anything from toxicity to possibility of causing some nausea and some other things to occur. So one of the things to kind of keep in mind is that most of your stores and most of your pharmacies are going to do the exact same thing. Whenever we get a recall notice, we immediately pull that product off the shelf. The main purpose of that is to make sure that nobody else is going to get any of that. The main place that we normally get a lot of this information from is either our main drug distributors. So a good example would be like Cardinal, McKesson. These are all main companies that actually distribute medications to the pharmacies. They will normally give us a notice about any major drug recalls and what to look out for on them. The other thing is the FDA actually will come out. They are the ones that are the overriding body that will normally keep a kind of track of everything that's going on with those recalls and send out the information to all the different pharmacies and drug companies and stores. With hand sanitizer, it kind of fell into that category where a lot of people were buying hand sanitizer because it was hard to come by. With COVID currently going on and being a big crisis for a lot of people, this was one of the safest ways to kind of help protect people. With that being the case, some of the companies have had some issues where some of the ingredients that were added were causing a bit of a problem. Now, the thing to keep in mind is you have to be careful about where you look about these drug recalls. The FDA is probably one of the best websites to use for it because the problem is a lot of news places and a lot of news channels will come out and state that there's a recall on a particular product, but they don't always specify which product it is, what company it is, or what lots or expirations to be looking out for. With that information, the FDA actually does give you a general list, so you can actually look for those drug recalls specifically for any of the products that you may think that you have within your household or anything that might be related to it. Whenever those go out, we typically will send a message out to most of the general public as well, either on a store's website or if it's a patient at a pharmacy, we'll normally actually take the time to send something to the patient themselves from a corporate office. That's to let you know that there's a possibility that the medication you received or the hand sanitizer that you received could be impacted. Now, that doesn't necessarily mean you have to throw everything away right away. You can always verify with your pharmacy or your store just to make sure that this was part of a recall. Most of the time you can be refunded for things such as hand sanitizer, but with medications, we may not necessarily want to jump the gun depending on what's going on. We need to get you something else to possibly help with any of your health conditions. So with that being the case, I always say if you have any doubts or questions, check with the FDA, but also call your pharmacy because we can normally help you out with that to figure out if there's anything to be worried about or not. A lot of different pharmacies use a lot of different companies, so it's hard to necessarily pinpoint the exact one. In very rare cases, if you had heard over the summertime, there was a big issue from probably about 6 months ago with certain blood pressure medicines causing a problem. It was only one particular type of blood pressure medicine, so we were taking the time to get a hold of everybody's doctors to get that all taken care of and switch them over to something that may not be impacted by the drug recall itself. But at the same time, it could put you at a high risk if you chose to just stop taking your medication altogether versus what the recall could be about. So with that being the case, don't ever just jump the gun. Make sure you're asking the right people and the right resources, or looking up the right resources, I should say, and checking with your doctor's office, your pharmacies, your nurses, just to make sure everything's okay with that first. But if you ever have any doubts or questions, like I said, just call your local pharmacies because we're very good at knowing at least the most current recalls that were occurring. And like I said, if you ever look online, you can typically find different resources and sites, but like I said, the FDA is the best one. If for some reason you think you've taken some medication and you may have some problems that are occurring with it, the FDA actually has on their website an area where you can actually file a claim that is either patient-friendly or like a provider-friendly, so your doctor's offices and pharmacies. We can submit information to the FDA directly to let them know that there was a problem with something because there could be a recall that doesn't exist yet, but there could have been an issue with the manufacturing, and we don't know anything until somebody tells us about it. So with that being the case, if you ever need to, you can file it there, or like I said, you can always call or talk to a local healthcare professional and just ask them on their input or what they can find out for you. With the mention of COVID today, that is our main topic. Now, I know on previous episodes we've talked a little bit about small things about COVID, but actually we're going to go in a little bit more in depth today. With COVID being such a problem universally across the world right now, and especially here in the United States, because we have one of the highest cases right now, I figured I'd get somebody that's had some experience with it to come and talk to you guys today. So with me today, I actually have a student with me. His name is Patrick, and he actually is a student with Neomed, but he has actually dealt with some cases of COVID patients in the ICU and ER. So I'm going to have him help me out a little bit today with this. Hey, Patrick, how you doing today?
Doing well, Chris. How are you?
Good. So I was going to say, let's kind of jump in a little bit. So what exactly is COVID-19?
It's a respiratory disease. It's a virus that infects your lungs and kind of like the tract that leads up to your lungs. And what it does is it attacks the cells that's lined in the area. Those cells then die off, and then your body sends the signals to go and fight the virus. And then the virus then infects like your immune system cells that are trying to fight the virus itself. And those immune system cells are calling in more cells to try and fight the virus, and then that kind of starts off this whole cascade of problems we see now. So you went from having a disease that not only attacks the lungs, but now it's starting to force your body to kind of almost overreact to its presence. And so that's like a major complication we see with these patients.
So it's kind of like a form of like, almost like inflammation, like when you cut yourself, how your body, like it gets a little inflamed, a little red, but this is actually happening on the inside of your lungs.
On the inside of your lungs, and in some cases could happen throughout your body. And we call that a cytokine storm because it becomes like a giant storm throughout your body.
Gotcha. So with that being the case, because I know some people have always been concerned about it, because at the end of the day, you know, you're never quite sure if it's something else that could be going on with it. Because people have colds, people have flus. It's coming up around that time of the year as well. People have just normal COPD or asthma, other breathing conditions that exist. So how do we kind of differentiate, I guess, COVID-19 in regards to like signs and symptoms from some of those other problems in the lungs?
Right, and this is a difficult problem because what you'll hear most of the time on the TV, it's flu-like symptoms, because that's just a broad term, because it's major symptoms that it shows, it's similar to the flu. So these are your coughing, your chills, your fevers, body aches. And what we managed to try and differentiate is we're seeing cases of people waking up with like new loss of sense of smell, new lost taste, sense of taste, things like that. For the most part, these will we'll put these people in kind of two different boxes. If you get sick with the virus, you can be either asymptomatic or pre-symptomatic. Both of these groups have the virus, but when you're asymptomatic, you're infected and you are sick with the virus, but you don't actively show the symptoms. You may not have a fever, you may not have a cough, and you may not have body aches. When you're pre-symptomatic, you're sick with the virus, but you're going to eventually develop the symptoms much later. So that's some of the confusion that we have when we're reporting these kinds of things, because what makes it difficult is we're all learning new things right now. This is like new science happening at this exact moment. So treat it as if you almost have the similar symptoms as the flu. If you notice something like high and severe kind of developing over a short amount of time, that's one of the major symptoms.
Yeah. So kind of looking at it for the most part, the one thing I think we always like to stress to everybody, especially from the pharmacy side, and I'm sure doctors' offices as well, is that we want people to understand that we're talking new onset. So, you know, if you have a history of COPD, if you have a history of asthma, you could have some natural breathing issues, but the main thing, like you had mentioned, is it's kind of new onset. We want to make sure that, you know, people aren't developing these unusual, like way more difficulty with breathing and way more unusual, like coughing up of sputum or weird things where it almost feels like an elephant sitting on your chest tightness that just has never been there before or never felt like that before. So, yeah. Now, the one thing that I've had from some people is that they're never sure how long they should be looking out for it or anything like that. So typically on average, like how long do the signs and symptoms normally either start to incubate, or how long do they kind of last for some patients?
So say you got infected with the virus, probably your incubation period could be 7 to 14 days before you actually get severely sick. So that's why I mentioned asymptomatic and pre-symptomatic, because that's another big problem why we're so worried about COVID spread, because it makes it hard for people to realize that they're actually sick and like stay at home and rest when they could be walking around for up to 2 weeks and accidentally spreading it and not knowing that they're spreading it. So in general, for the most part, it'll take at least 7 days for you to start developing these chills, these coughs, shortness of breath, body aches, losing a sense of taste and smell, at least for the first 7 days. Then after the first 7 days, that to like 14 days, that's when we can start seeing more severe symptoms, where you have that, in the most severe case, respiratory failure, severe nausea, vomiting, lightheadedness, dizziness. And this is usually when people start going to the hospital or start going to the ER to try and get some care and get some help.
Gotcha. So yeah, so with that being the case, as you mentioned, the asymptomatic is probably the scariest because you could be infected and just not know it for a very long period of time there. One of the things that they do always mention too that I've noticed is that, especially with emergency rooms and ICUs, a lot of these places they'll normally state, if you have any of these symptoms that we're mentioning now, to let them know ahead of time, because
Right.
the main thing is we don't want people just to run in immediately and then all of a sudden you could be carrying COVID, you could be spreading it amongst all these different people and just not even realize that that's what you're fighting. So
Right.
now the biggest concern that I have from a lot of people is that I guess politically speaking, this show is not affiliated in any particular manner. We don't represent Republicans, Democrats. We're kind of a neutral, unbiased production for you guys. The main thing, though, that I'm kind of wondering about, though, is the concern behind it. Because a lot of people, I don't think, really understand what we should be looking out for, why this is such a big deal. So from your own personal experience or from things that you've seen or know about, and from like what the CDC and the FDA have said, why would we be concerned about COVID compared to, say, any other viral infection like a flu or cold?
Okay, so we'll start there with the viral flu or cold. So we have studies now that show comparing the COVID-19 virus to the flu and the Middle Eastern severe respiratory disease virus, which is another form of SARS, severe respiratory disease virus. And SARS and MERS are kind of the same family as COVID in how they spread and in the type of virus that they are. So when we looked at how easy it was for the flu and MERS to spread, we look at a value called the reproductive rate. And what that shows is how easy can this spread per person. So we'll say 10 people in a room. With the flu, the spread is 0.9 to 2.1. So maybe we'll round it to 1. 1 to maybe 2 people out of 10 people can get the flu. With MERS, it's 0.29 to 1.44. A little bit lower, but now it's less than 1 to maybe 1 person out of 10 people can get the virus. Then we go to COVID. COVID is 1.4 to 3.9. So at the lowest, minimum of 1 person. At the highest, 4 people in a 10-person room can actually get the virus. Its ability to spread is just that much more, I guess we can say it's just that much more infectious compared to other viruses that we've seen in the past that we typically consider to be highly infectious.
Gotcha. So yeah, with that being the case, the infection rate is significantly higher than what we have dealt with other viruses and other problems in the past.
Right.
With that being the case right now, because of the infection rate being so bad, can you give us a little bit of information about even just in general, like with Ohio right now, how we're handling with COVID in regards to cases and other things?
Okay, I have data from kind of like the national level. So as of today, October 2020, we have had 8,680,611 new cases since we started monitoring them in January. And we have had 225,084 deaths since COVID hit the United States.
Gotcha. And then in general, I believe, if I'm not mistaken, with Ohio, like we have a rising amount of cases, of course, at this particular time. So it's always been kind of a bit of a concern. I believe as of today's date, as of October, right now, the main thing was I believe they said that there was about 2,500 new cases that are popping up consistently. With that being the case, I mean, in order to find out how many people are truly infected, we always have to test everybody to see what's going on with that. But I have heard there's multiple different types of testing. So
Yes.
for somebody who may think they have these signs or symptoms or are unsure, How would somebody go about getting tested for something like this? Like, what kind of tests are there?
So probably the most common one that we've seen and that everyone's probably gonna experience is the nasal swabs. Those are the ones that you can get at, I believe, some pharmacies. You can sign up and make an appointment, and they'll run it through your insurance. I haven't heard of anyone having issues with their insurance and getting the nasal swab test. But what the nasal swab test that we'll typically see and get, that will show if you're actively infected with the virus. Then later, hospital care workers are actually getting an antigen test. The antigen test misspoke. The antibody test. The antibody test is usually drawn by blood or finger stick, and that will usually show if they were infected in the past. And we do have another antigen test that's similar to the nasal swab, but it also shows an active infection.
Gotcha. So we're kind of seeing a couple different tests, but it looks like there's the two main tests are the ones that are telling you if you're actively infected or not.
Right.
Now, the main thing, as you had mentioned, some of the pharmacies, the main places, if anybody's curious or if anybody wants to go ahead and get tested for it, I believe most of your CVS and Walgreens locations, not all of them have shifted over to it yet, but those are probably the biggest pharmacy chains that you'll see that are advertising them. There are certain places that you can always double check too. So you can double check with your doctor's office just to make sure. But if you have any doubts, any concerns, you can always call these places ahead of time just to confirm if that pharmacy is actively doing COVID testing. They have been rolling it out through a lot of the different store locations, but not all of them have actively jumped on board with it yet because they're still trying to get a lot of the testing materials out to them and get all the pharmacy and technician staff trained to make sure that they're doing it correctly for you guys. But as Patrick had mentioned, the best thing you can ever do is just please go online and sign up for a time frame. It's very hard sometimes on the pharmacy staff in general because we're still busy trying to maintain, filling prescriptions for sick people or taking care of people's maintenance medications, that it's kind of hard to fit that into it. So they always say scheduling ahead of time is better than just walking in on a whim. And most of the time, these testing locations will do it through typically the drive-through. So they normally recommend not to get out of your car and go into the facility because you always run that risk of possibly infecting other people if you did have it without realizing what you were doing. So they always say stay in your car, use the drive-through if anything, but that's probably going to be the best way. They may have you pull off to the side to do the test itself, but as Patrick had mentioned, the nasal swab is probably the most common test that you'll see at these locations, and it's very uncomfortable for some people, but it's a necessary process to get you correct results on that. So kind of shifting things back right now, what are some things, I constantly hear people, asking the question all the time in the pharmacy, are masks working? Is hand sanitizer working? Like, what can we do to help prevent COVID from spreading essentially from people?
So this is part of where you have those conflicting statements. The first one that we know for sure is there is no surefire way to prevent COVID, no surefire way to prevent a COVID infection. A lot of the measures that we roll out, like the hand hygiene, wearing a mask, lowers your risk of getting infected with the COVID. And we do have studies that show how effective these measures are. And the way we looked at them was we looked at an odds ratio where we had a value of 1. Say your chance of getting infected with COVID is above a 1. So if I get this value with masks, for example, and it's over 1, that tells me that it doesn't really help reduce my chance of catching COVID. If it's less than 1, it reduces the chance of catching COVID. And they compared it to cleaning your hands often, disinfecting your environment, and wearing a mask. What we found was wearing a mask individually was a lot more effective than cleaning your hands and disinfecting your surrounding environment in terms of catching COVID. So masks are effective at reducing your chance of catching COVID. And they did a study in which they compared if we combined mask and hand hygiene in a residence hall with students with catching influenza-like illness. Why the influenza? It spreads by air just like COVID does. And what they found was when they implemented hand hygiene and mask policies in the residence hall, the rate of influenza-like illness in those students dropped by 35 to 51%.
That's incredible. So, yeah, simply just wearing a mask and using simple hand hygiene is enough to kind of keep things in check with airborne viral infections then.
Right.
Okay. Now, the main thing to keep in mind is I also get a lot of questions about hand sanitizer. The one thing in general that I would let everybody know about hand sanitizer is that with hand sanitizer, they typically recommend at least 60% alcohol. That's the main cutoff point for a hand sanitizer. With that being the case, anything that's at 70%, that's great, but it doesn't necessarily have to be that high. Anything that's above that is just kind of overkill at that point, and it may not be as effective or work as well. So whenever people are looking for hand sanitizers, I always tell people, make sure that you're looking for at least 60% ethyl alcohol is listed as the main ingredient. Anything above that, like I said, 70% is great if you can find it, but not all places have been able to manufacture it at that high just due to the shortage of the materials and the resources necessary for that. The other thing is if you're wiping down surfaces, what they do recommend too, according to the CDC, is that it's at least the 70% alcohol works best. If you jump up to around that 90% alcohol, there's not enough water in there for it to kind of stay on the surface to ensure that it does kill everything. So it actually might dry out faster than when it would actually kill everything. So I have a lot of people that naturally just think when they come in, hey, 90% is more than 70%, this has to be better. And actually in this particular case, it's actually not recommended to do it that way. It's actually recommended at the 70% alcohol. They do say also that you can use a bleach combination. There is a mixture that they have listed on the CDC's website to let you know the best way to make a bleach combination that would work for cleaning surfaces. And the last thing is that in a lot of your stores, you'll see a lot of like the hand wipes and sanitizer wipes and things like that. If it specifies that it takes care of what they have listed as SARS-2 is what it is, it would be very similar to helping to take care of COVID-19. Those are the ones that you want to look for if you're truly looking for just a general wipe to wipe everything down. Not all of them are going to have that listed, and most of the time you have to look on the back of the packaging in the ingredient section. Down towards the bottom, it should give you a list of all the bacteria and all the viral infections that it's supposed to help put in such a small enough quantity that it would actually have no impact on you. So if you do any general shopping for that type of stuff, please check the back of your listings and your packagings. That's typically the best way to kind of handle those situations. If you have any questions, like I said, the pharmacists are always there to kind of help out, or even check in with your doctors, nurses. That's typically another place that you can kind of get some of this information from. So kind of jumping back in, we did talk a little bit about for prevention purposes, but for people that are actively sick, I'll be honest with you, the president has mentioned a few different medications that have been thrown out there, and there's a lot of mixed evidence. So at this particular moment for treatment purposes, are there really any medications that are out there for it to help treat COVID?
So unfortunately, as of this time, we haven't been able to find anything that actively helps kill the virus in the body. So for the most part, all of our treatment is based around shortening the time that you're in the hospital and lowering mortality rate, lowering your chance of dying if you are sick. So we'll start with the most obvious one, Plaquenil or hydroxychloroquine. It is indicated, approved for use for malaria and rheumatoid arthritis. The way Plaquenil works is it actually kills the parasite in malaria. It disrupts its digestive functions, and so the parasite dies. In the case of rheumatoid arthritis, it helps lower inflammation, that painful swelling and tenderness in the joints, because it actually lowers the immune response, so it doesn't overreact, and then you get those painful swellings in the fingers. So based on that, it was theorized that maybe Plaquenil could help in the case of that cytokine storm. Unfortunately, we found that it doesn't help at all. It hasn't been able to shown in reducing mortality rate and also lowering time spent in the hospital. But we do have 2 approved treatments for COVID at the moment. These treatments kind of come into effect when you're in your most severe case of COVID. So these patients are the ones that are now in the ICU. They are now intubated, where they have a tube in their throat because they can't breathe as well. These are the most severe cases, and that's usually when these treatments are indicated. The first one we'll talk about is remdesivir. Remdesivir is an IV drug put through in your veins, and what it should do is it's supposed to inhibit the virus being able to grow at its RNA as basic genetic level. And in lab studies, it's shown that it has actually prevented COVID itself from growing, but we haven't seen that as effectively in the hospitals. But what remdesivir is approved for is to shorten the time it takes to recover. So we typically use it if we're seeing a patient getting like lower, 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 and we're trying to just kind of pull them back or try to just get them to the point where they can actually recover from the symptoms. And the next one is dexamethasone. It's a type of corticosteroid. Pure function is to reduce inflammation in the body. And because with COVID, you have such severe inflammation due to the body's response to the virus, this was found to actually lower the mortality rate, since a lot of the secondary complications that occur with the COVID infection is due to the cytokine storm, due to that mass inflammation in the body. So in general, the guidelines recommend remdesivir and dexamethasone only in severe cases of COVID. And we'll show you guys like the current guideline treatments as of October 2020 for the use of these two medications.
Okay. Yeah, so the image that we have here, it'll kind of just give you a general look at how we're trying to handle it as best as we can for right now.
Right.
One of the things that they always mention is that there's some other, it's not even just the inflammation that's going on, but there are some other issues that can sometimes come up with those. Can you talk a little bit about that real quick for us?
Yes, real quick. So we're unfortunately finding out that due to the cytokine storm, this actually started causing heart complications. I guess a short and easy way to say is heart complications. In general, it's more cardiovascular disease complications. What we found, taking data from China, over 44,000 patients, the primary symptom wasn't respiratory symptoms. It was actually cardiovascular symptoms. These would be the palpitations, the irregular heartbeats, things like that. And we're finding now that because of that mass inflammation, the body's actually now kind of unstable. So if the virus was able to leave the GI tract and it gets into your blood vessels, it's going to attack the cells lining your veins. And that then causes the vessels to kind of be unstable. Then you could have like a rupture. If that ruptures, your body reacts by making a clot. And then that clot travels down, it gets in your heart, you have a heart attack. Gets in your lungs, you have a pulmonary embolism. Gets in your brain, you have a stroke. So it's kind of like the secondary complication we're seeing is cardiovascular. In the broad sense, it's cardiovascular, but more specifically, it's due to that mass inflammation you're seeing. And that's causing like all that coagulation issues, causing the irregular heartbeats. It's causing like a PE or a heart attack, things like that.
Gotcha. And that kind of is reinforced from what the CDC had come out when they had released some information from a few months back,
Yes.
stating the complications and problems that came up with COVID with a lot of these situations that led to death. It wasn't necessarily that a patient was termed COVID death only because they didn't die from COVID, they died from a heart attack.
Right.
But as you had mentioned, like we're more so concerned about those secondary symptoms that are occurring due to COVID. So you
Right.
could recover from the respiratory issues, but now it's leading to blood clots, so strokes, heart attacks, other serious issues. So some of these patients may have had pre-existing conditions, but it was made even worse by COVID, which is the main culprit leading to them passing away. So
Right, and
that's
that is like a major contention point right now. That's where some of the issue comes, where people are like, oh, these numbers aren't actually from the virus itself, which is true, but the deaths are a complication of having the virus.
yes. Yeah, so with that being the case, the other big thing that's been coming up in the news lately is vaccinations. So we keep hearing about a COVID vaccine. Can you tell us a little bit about what's going on with that right now?
Right now we have, I believe, 3 major trials looking into creating a COVID vaccine. They're still early enough. They're actually still taking volunteers who want to sign up and test out the vaccine. But as of this moment, we don't have a vaccine yet. Transitioning to that, they also looked into whether it's worthwhile in getting the influenza vaccine, the flu vaccine as well. And studies have shown that it's still safe to get the flu vaccine. And it is recommended to still get your flu shots, because I believe earlier on when we were dealing with COVID, we were testing people for COVID and for influenza as well, because we were actually seeing higher rates of both appear at that time.
Gotcha. So we're kind of seeing both. And the main thing that I think for a lot of people to understand is the reason that we help promote immunizations in general from our standpoint is the flu virus is a completely different virus than COVID. They're not the same thing. Mm-hmm. You're not going to get any additional protection with getting the flu vaccine against COVID. However, we're preventing that co-infection. If you were to be hit with both COVID and flu, COVID's already hard enough on your body to begin with. The flu's just going to make it worse. So
Right.
to be on the safe side, we do recommend everybody get their flu vaccine, especially this year, to be on the safe side until we can get some more information out there. Well, thank you so much, Patrick. I know we kind of just touched on the surface of COVID, really, to be honest. So there is a lot more information that we could possibly find for people, but at the same time, we have a limit on our time here, so we kind of hit what we could for you. So for today's episode, thank you guys so much for tuning in on it. The main thing, if you have any questions or concerns, like I said, the CDC is probably the best website to check for in regards to COVID. They have sections that are dedicated specifically towards for general patients to understand, and it talks a lot about prevention purposes, different websites that you can go to that are trusted to find out certain information about different, recalls, different issues, different information that's coming out in regards to vaccinations and what to look out for or what to think of. And then the main thing is, if you ever have any questions, like I said, this is a great time to start asking healthcare providers. That's what we're here for. So ask your doctors, ask your nurses, ask your pharmacists. We're literally all trained to kind of help guide you guys in the best way possible with the best information out there. Like we started at the beginning of this episode, the main thing to keep in mind is all the information that we're mentioning to you guys right now is current as of right now. It could change anytime later on if this is aired at a later time, so kind of keep that in the back of your mind. But if you have any questions or problems, by all means, always ask. But thank you so much for tuning in today, and as always, stay healthy and stay happy out there.